Good afternoon. I'm Noni Lasso, Chair of the Board of Early Education and Care, and I want to welcome you all to a public meeting of the board. Thanks to my fellow board members, the Secretary and the Commissioner and her team for the time this afternoon and for all of the work that is reflected in our agenda and materials. So we're coming together following a meeting in June, and I would say still coming together under very complex circumstances and after yet another few challenging months for the field. And I think we come together with the same gratitude and support for the field now in this reopening phase of work. As you saw from your materials, fellow board members, the Commissioner plans to give a comprehensive update of where things stand and what is on the horizon, including with discussion about some of the associated policy and practice issues. The genesis of one item, the revisions to the background records check, was in fact pre-COVID, but under COVID conditions has become all the more urgent. So we'll hear about those proposed revisions and aim to vote to put those out for public comment. I think bigger picture, as we focus on our collective work together and look to the weeks and months ahead, I think we can probably all predict what's in store. And I think, personally, I think of these things in at least three buckets, some of which we touched on in June. First, maintaining health and safety protocols and conditions while also ensuring that there is joy in the learning and the care experience during this sustained public health crisis. And I know that it's in the DNA of our providers to engage our children and families in positive and supportive ways, even with the challenges that COVID-19 presents. And I look forward to just continuing conversation about supporting child development at the board level, which partly means a real focus on support for the workforce, of course. Second, I think there is surely going to be pressure on childcare providers and the field to support gaps in the on-site school district services this year and to support working families. So we'll need to adequately support the field to deal with this pressure. Not to be understated, I know the Commissioner and her team is actively working not only on the reopening plans and guidance for September, as we discussed in June, to align with K-12, but of course, these circumstances are even all the more unprecedented, and we are going to have to think creatively and really push on alignment and support the Commissioner, the agency, the field. And third, I think as we plan for the year ahead and as we all agreed in June, this is also following actually on our conversations in March, which feel like a world ago. This is also an opportunity for us to make a commitment to rebuild stronger and even more sustainably than our system was before the crisis. So we don't want to lose that opportunity, not just in the spirit of continuous improvement, but also against today's backdrop of the disparities and the longstanding inequities that the pandemic has highlighted and that motivate so many of us to continue to do this work. Central to the everyday lives of so many of the families we aim to serve and the EEC providers. So I really think the conditions show and tell us that we really can and must do even better. And in March, we laid the groundwork to do that. So let's continue in that spirit as well. And so more concretely, as we look to September's meeting and given the Commissioner's strategic work incorporating updates and lessons learned over this summer, we should be in a good position next month to revisit the strategic plan and to think ahead together. So in sum, to open this board meeting of the Board of Early Education and Care, I know I speak for the entire board when I extend ongoing and deep gratitude to the agency, to the Commissioner, her team, and especially to the field of providers who have made this look very straightforward and seamless, who have quietly mounted childcare in almost 4,500 programs as of just a couple of weeks ago. And I know that it's not easy, and I know that this work has been essential for decades, that it's about mission, and it's especially about the children and families of the Commonwealth. And we, the board, remain truly, truly grateful. So I'll turn it now over to the secretary, then to the commissioner, say a few things about public comment, and we will move forward.
Great, thank you, Madam Chair. And I just want to echo the gratitude that you're expressing both for the department team and for everyone in the field for their hard work during this period. We shouldn't underestimate the amount and intensity of the work that's been going on, but the creativity and flexibility that everyone has showed in, trying to make it work under very difficult and ever-changing circumstances. I also just want to note that it's clear, especially from the provider point of view, that they're exhibiting a tremendous amount of empathy for the people who work for as members of their teams, for the families who are struggling through this period, and obviously for the children as well. So again, just want to echo the wonderful words of our chair of gratitude. Also want to update folks on the call, both members of the board and folks tuning in on what the governor just announced about an hour and a half or so ago, in particular around clarifying the data that is going to be used to evaluate the condition of all the communities in the Commonwealth relative to the presence of the coronavirus. Specifically, there's now a red, yellow, green sort of stoplight kind of color coding that's being used, including white, which is not in a stoplight as far as I know, in order to categorize each community. And basically what it means is if you're white or if you don't have a color, it means you have fewer than 5 cases in total. So these typically are smaller communities. And as you know, out of 351 cities and towns in the Commonwealth, we have a lot of very small communities. And so if you have fewer than 5 cases in total, you would be in that white category, notwithstanding the ratios. And those ratios are in the green zone, fewer than 4 cases per 100,000 residents. And that basically means that you're well under the sort of standards and benchmarks that are being used internationally and nationally to assess the impact of COVID-19. And so if you're in that category, all things being considered, that's a pretty good place to be. And there are something on the order of 75 communities that are in that category. Then there's the yellow, which is more obviously of a moderate risk category. There are about 29 communities in that category. And these are typically larger cities and towns, but not exclusively. And these are communities that have between 4 and 8 cases per 100,000. When I say cases, that means new cases over the past 2 weeks. So this is a 2-week cycle of data collection that happens, and those numbers reflect the new cases during that period. And then finally in the red zone, which is the places of highest risk, we have 4 cities. They're actually clustered together. It's Chelsea, Everett, Lynn, and Revere. And these are communities that have more than 8 cases per 100,000 residents. So this is important, obviously, on a number of different dimensions as those communities start to think about what measures they need to put in to bring the cases under control, what areas how the state can target its resources to do the same, both in terms of enforcement of protocols and provision of additional services and testing and focusing on contact tracing and a variety of other things that can be done in order to mitigate the impact of COVID in these communities. It also has implications for school and school reopening plans. Now, as I think all of you know, school districts have been working on those plans over the course of the last month. They've already submitted initial plans, and consistent with that data that I just described, the vast majority of communities are planning either fully in-person or some kind of hybrid, combination of remote and in-person learning in the coming semester, starting this September. And by the way, as you may also know, school openings have been typically pushed back till mid-September. So schools that we're planning on starting the end of August or the beginning of September have moved forward in order to enable more time for professional development for teachers and other staff. But the vast majority in their initial submissions we're planning on having, again, some level of in-person instruction, although that level may vary from place to place. Those decisions are subject to change, but hopefully now they will be better informed by the new data that's just been released and the data that will continue to be updated over the course of the next month. As the districts are completing their plans and as they are preparing for actual implementation, it's critical that they are communicating with, working with, collaborating with, coordinating with the childcare providers, the early education providers in their communities, especially to the extent that they are planning to have schedules during which students will be learning remotely or outside of school. While certainly over the course of the last spring, much of that burden was placed on families, and children and students were basically working out of their homes. More and more, parents are going back to work. Other conditions are intervening that are making it more and more difficult for children to remain in their homes and continue to learn, especially at a higher level, we hope, than we've seen in the past at the end of the last semester. And that means it's going to put additional pressure and maybe significant pressure on our childcare system and our early education providers to manage the increased demands. There may be need for additional capacity above and beyond what our current system has, but just looking at the system and the providers who are out there, this is going to put significant pressure on them, and therefore it's critical that we're coordinating at the local level and at a detailed level, logistically and otherwise, with our schools, between our local schools and our providers, to make sure that we're somehow not either having children or families fall through the cracks or ending up with children in unsafe situations. So I just want to sort of underline that point that we certainly, and this is true, I'm confident for the folks at the Department of Elementary and Secondary Education, and for the most part for schools and districts in our communities, we just need to make sure that we're thinking about ourselves here as a team and not as sort of siloed systems that don't connect to one another. That's never been the case in the past, but it's especially not the case now. We really need to be doing this work together. And so anything that any of us can do, and I certainly take responsibility for that myself, to make sure those connections are getting made and that coordination happens, I think just needs to be a high priority for everyone. So with that, let me turn it back over to you, Madam Chair.
Thank you. Commissioner.
Absolutely. So thank you all for not only for the ongoing support and the kind words, but I think all of the weekend and late night calls and all of the support that I know you all have been providing for me personally and for the department as a whole throughout this whole crisis. And really want to send a deep gratitude to the team that is not only keeping one foot in the strategy and keeping one foot in the moving forward, but also absorbing a lot of anxiety from the Commonwealth and our providers who are all grappling with the real difficult choices on the ground that they're making on a day-to-day basis. And so the team has been absolutely incredibly grappling with their own working from home and trying to figure out their new normal, but also being there for the field as we all settle into a new normal for the program year together. But I also just really want to acknowledge for the team that has been working with the field is that those, the team is doing amazing work but the work happening on the ground right now, just echoing the thoughts of Madam Chair and the Secretary of that this is a real-time learning, and the dedicated professionals who are working to try to figure out how to keep their environment safe in real life situations have done the adequate planning and are really trying to continue to be the support for families, bring the joy to the children on a daily basis, and experience joy from children on a daily basis is nothing more than remarkable to witness. And well, I have said to many legislators and many officials who said thanks for our work, I really do feel like it is not our work compared to the work that they are doing on the ground every day with children and families is pales in comparison. So thank you to everyone who has been working and supporting children and families on the ground, and knowing, as the Secretary said, that we are at a moment where we are both thinking about the now and the future as we look look towards September and beyond and how we do support our communities to partner together, I really just know that that is going to continue to rely on not only the dedication, but the creativity and the innovation of those folks on the ground that are really working to try to create creative solutions, and in times and systems that none of us knew we'd have to build. So we're working as quickly as we can to support you, but it really is going to be those the ideas bubbling up. And from all of the hundreds of providers I have spoken to over the last 4 months and hundreds of parents that I continue to speak to, that it is their ideas and it is their dedication that builds the momentum for EEC, and teaches us how to make sure that we are as responsive and as supportive as possible as you all are working with families. So I just would be remiss if I did not start there. Before we move on, I also just want to address some of the things that I know are came up in public comment that I know that Chair Lasso will make sure that we are addressing. But I do want to talk about right now where we are in the now and in the future, as we're looking at really scrambling and working as quickly as possible to answer questions and build responses to as I said, and continue to say, questions that we didn't know to expect a few months ago. And so really trying to make sure that we are keeping up with that support. We also are recognizing that this is something we're setting up for the long haul. And as we talk today about thinking about how we rebuild, and don't look at this as a moment in time of how we scramble, but how we do that towards a bigger, stronger, more robust system than we went into this crisis with. And I think that as we look at that, we cannot stop thinking about the urgency of the now, but are balancing that with the foundation that we'll need for the future. I do want to address a couple of things that I know that are pending questions that we won't dig into today in agenda items. So I would like to make sure that all of you and those who are attending today do know. First, the guidance, which I know is a anxious point for all of us. We'll talk a little bit about what to expect today, but it is, as the Secretary said, working carefully with DESE to make sure we are providing the most robust and comprehensive guidance that we know our providers need to plan for the fall. And so, as we've said, and we'll allude to today or describe today, some of the things you can anticipate in that. No, we are working, and we know you need to prepare. And as district plans are solidified, that we are trying to give you the information as quickly as possible. But there are a couple big questions that we need to answer to be able to make sure that we are not giving you information that will change over the next few weeks, knowing that a change in information could really be a big impact on operations for those of you trying to start up. That also includes not only our childcare agencies, but also for those providers, the coordinated family and community engagement entities, when we look at other support services that EEC supports, that funds on the ground, that we're really thinking about all of those contracts in the same way, with the urgency of being able to set up what you need now, but to provide what you need from EEC to be planful over the course of the year so that we aren't impacting operations in a dramatic way. I also want to address, I know that has come up in public comment around COVID and childcare centers. And I want to alert one thing we won't talk about in detail today is what we've done since reopening childcare in terms of integrating our COVID reporting structure for childcare into our incident reporting process for licensed programs. And so during emergency childcare, obviously we weren't functioning under our licensing process. And so I had a slightly different system, but as we have reopened, gone back into our LEAD database, for those of you who are familiar, we have integrated that COVID reporting into our normal incident reporting process for those programs. And this will allow us to track closures and quarantines and any potential COVID-related exposure as it impacts our program operations and for our licensed programs. So we need to make sure that we aren't impacting payments or anything along those lines when we know that there is an impact. But since EEC does not actually have the authorization to track individual employees or family health information, we are collaborating closely with DPH to ensure that the contract tracing system that they have in place helps support the tracking of COVID as it relates to childcare specifically, which aligns with the legislative requirement that was passed in the supplemental budget. So I just wanted to address that and make sure that we all knew what we at EEC were integrating to make sure our systems were sustainable over the course of the year, and where we were collaborating with our state partners to make sure that we were providing the information and also integrating that information into our learnings going forward. And with that, I will turn it back to you, Madam Chair.
Great. So before we move to, I'll say a few things about public comment, and then we'll move into routine business. Any comments or questions before we do that? Okay. Let me say a couple things about public comment. We had the benefit of about 9 or 10 submissions by 11 a.m. this morning, written comment. We have several others that have come in since. We will address these very comprehensively. You will get all of them, and we will take them up in a way that makes sense, both in relation to the board's work and the agendas, but also we'll say more at our next meeting. For now, let me just give you a preview of some of the topics, wide ranging, obviously, across the dozen or so that we got this morning, but not surprisingly, challenges with finding and retaining staff, considerations for capacity in EEC health and safety requirements, considerations for subsidy payments and parent fees based on previous funding levels, requests for funding to meet the needs of private pay providers, requests to review mandates for non-licensed funded programs, requests to consider virtual and hybrid options for early childhood providers, and requests for COVID-related data in childcare centers. Just again, very briefly today, with a lot, we will all look carefully, get our eyes on all of the public written comment, which we so appreciate and take seriously, and we will move forward from there in thinking it through with the commissioner and her team. For now, let's move into the routine business. The first thing is to look and aim to approve the minutes of the June 2nd, 2020 meeting. Those minutes looked fine to me. I don't know if folks have any changes or suggested edits to these minutes. Okay, otherwise I will make a motion that we approve the minutes from the Tuesday, June 2nd, 2020 board meeting, and I will ask for a second.
Second.
And then I will engage in a roll call to be sure that we hear from everybody. So I'm just going to move across my screen, which I know is not the same as your screen, but that is how we are living these days. So I see Sheila with Joan Wasser-Gish on deck. Approve the minutes, Sheila?
Yes. Approved.
Thank you. Joan Wasser-Gish?
Yes.
Eleonora Villegas-Reimers?
Yes.
Mary Wallachy?
Yes.
Nikki Rees de Luzuriaga?
Yes.
Secretary Pizer, do you do minutes?
Yes, I do. Yes.
Okay, you're on. Good. Joni Block?
Yes.
Allison Schoenwald?
Yes.
Dave Cruz?
Yes.
Carolyn Kane?
Yes.
Samantha Agner-Trewergy? You don't. You know that I'm terrible at this. I remain terrible at this 5 years in. I do not ever somehow attach to the JD that I do not have. So minutes are approved from Tuesday, June 2nd, 2020. With that, we will move into our items for discussion and action. You will see that there's a deck that sort of moves through the 4 items, which are in many ways very connected. And I thought really well presented, kind of tell us the story of where we're at and what's to come. So I will now turn it over to the commissioner. And I suspect somebody will share screen.
Yes. Hi, thank you. So I wanted to start with an overview of what we have done as we've looked at the summer months and where we have looked at our subsidies and our caseload accounts in areas where we could continue to support families. We'll look today also at some of our reopening capacity projections of the data that we've seen come in so far. But as I started in my remarks, and I think as Charlotte so aptly set us up for, is also understanding how these steps and what we know is informing how we really look at our strategic plan and think about the year ahead, about how we make sure our energy and our efforts are leading to a bigger whole. And then looking at the BRC regulations. And as you all will remember, we'll give a little bit more background when we get to that part. As you all remember, that this was an issue we visited in the fall as we opted to not implement a couple of our implement one of our regulations and addressing some of the ongoing cleanup from the last few years of changes are here today to present the revised BRC regulations for public that would be open for public comment. So in moving through the next slide, as we look at the overview of the subsidy changes, again, you all have this and it'll be available. The PowerPoint is available on our website for those listening. So I won't read through it, but I do want to highlight that we are, as I have engaged with states nationally around some of the work that they have done on subsidy alterations and being able to adapt subsidy policies to help support families during this time. We are able to account to that we have pushed as much of the federal flexibility that has been provided to us to make sure that our parents still have access to this vital support for childcare payments, as well as making sure that our providers who serve them can have some flexibility on how they're able to support families in this tuition support. So in total, that has been about $160 million through the reopening. I will say that what we don't have yet is the continued tuition support that we provided through July. And given the fact that it is just our billing is just happening, we don't have the total amount, but assume that it will be at the same rate going forward, which will put us by the end of the summer at over $225 million. That has continued to go to about the 50% of providers who do receive subsidy payments. And so as we did that, then we will be moving, we have made some key policy changes to make sure that this funding and our subsidies are accessible to our families moving forward. So over the summer, what we did look at is making sure that we were paying by enrollment instead of attendance. This is really important and I think consistent with our strategic plan, as we talked about in earlier in the year, that in order to be able to sustain programs, being able to move from a per day per child amount to really thinking about paying for the child's enrollment, particularly in this time when we do not want to create any disincentive for a family to be able to stay home when they're sick, or for a provider to encourage the right kind of public health behaviors. This was a really critical change that we've made, and I think a very critical support for providers, and has allowed us a lot of flexibility to make sure that we are maintaining financing support for our providers, despite the fact that parents are in a variety of different health situations that have to be accounted for. And as the secretary pointed out, in a variety of different community situations that they need to be able to respond to as well. That also included for July and August for parent fees. We're in the process now of discussing a sustaining investment. Not sure exactly how we'll be able to sustain that in September, but in conversations with EOE and our counterparts in the budget office to make sure that we have some plan to continue supporting parents as they are as our jobless rate also increases across the country. And so I know every state is all grappling with these. I think that this has been a real key of allowing us to be flexible, but also be able to provide sustained flexibility. And so some of the areas I think as Massachusetts, we have been more innovative and been able to push farther is some of this 26 weeks for job search. That is a significant investment in our families to be able to let them know that this isn't a 2 or 3 week process, but that we want to support you not only to finding a job, but to sustaining continuity for your child as we all embark on the unknown ahead and grapple with what reacting to the data as it comes. In addition, we were able to get some regulatory waivers on behalf of our providers, and specifically on the OSD pricing limitation. And as many of you know, it had been coming up and certainly was brought up to me at the beginning of the challenges our providers were facing in accepting our subsidies, but not being able to offer scholarships to families that might be able to afford some, but not the full rate of our subsidy. And so this will allow them to be able to accept families at any rate, regardless of if they accept our subsidies moving forward, which will be particularly for those providers grappling with communities that are hard impact by COVID, has allowed them to leverage philanthropic funds and other resources to be able to really make sure our families still have services. And again, still continued our revisions to our closure policy that we put in place during emergency childcare that allows us to pay for any approved closure or due to quarantine or potential exposure, and are working closely with the approvals from the local Board of Health to make sure that we have that process in place and that we are responsive and supportive in implementing the recommendations of the local Board of Health as they are made on a case-by-case basis to our providers. I do want to note that, as the Secretary pointed out, as we are looking to support communities in collaboration and partnership for the fall, we are looking at continuing sustaining and other modifications that will allow us to make sure that providers have what they need to be able to be good partners at the table with their communities as well. So happy to answer questions on here, and before we move on to the next agenda item.
Questions from folks? I think you can just jump in because I can't see everybody unless we use the participant raise hand, but feel free to jump in. Okay, thanks.
Okay. So when we look at the reopening capacity projections, I wanted to give a quick landscape of the reopening summary of where we were before COVID as we look forward and look at what it has looked like since the reopening process. So again, to reopen, a provider had to submit a preparedness plan and an attestation that they were ready to implement that plan. And I really want to emphasize this because as I've looked through things that have happened since our incident report since COVID, it is really evident that those plans have made a difference, and that those people who were prepared knew where an isolated child needed to go, knew where the phone numbers for the parents were at all times. We're really prepared and confident in being able to address issues as they came up. And as I said to a network of our colleagues earlier today who are supporting our providers, I look at our own experience at EEC when COVID impacted us as a department shortly after our board meeting in March. As we looked at that, our preparedness plan that the federal government required us to put in place was actually a key crutch for us to be able to adjust and implement our needs quickly. I'm not saying that it was perfect. I'm not saying that I knew every element of it, and I'm certainly not saying that didn't need to be adjusted. But having that in place allowed us to give a starting place in a moment where everyone was very anxious. And I look for that kind of crutch for our programs as you encounter challenges over the course of the year. Those preparedness plans are things we'll continue to work with you on, and is why we focused on that in terms of reopening, as opposed to some compliance metrics that was really about trying to figure out how do you prepare people for dealing with the unknown ahead. And so we've done that. The forms were approved. You'll have the numbers. You have the numbers right there. So this is as of a couple weeks ago. I will tell you that we are just over the 5,100 mark for 5,200 mark for programs approved to reopen at this point. We have seen things slow and trickle in, so it hasn't been a dramatic increase, but there has been about maybe 8 to 10%, 5 to 10% increase on some of these numbers since then. We have making sure that our subsidized providers who are accepting our subsidies in order to continue getting paid for our subsidies, because we needed by federal regulation to have that parent have the choice to return. They did have to reopen. Again, this is a parent choice question to make sure that if they weren't going to, that parent could take that subsidy elsewhere. And that really trying to think about how we sustain given that requirement in collaboration with the Federal CARES Act and the legislative appropriation of that and the supplemental budget, how we could make sure that there was some grants for reopening. So you have the numbers there, and we'll go over that in a second. But just when you look at compared to what our pre-COVID landscape is, you have there, it's over 75% of our providers have submitted plans to reopen. There are and we'll go over the data in a second, but just to remember that there were almost 250,000 slots across those 8,100 providers prior to COVID, and still looking at our supply demand, while it's not one for one, certainly have far more of those children who were in working families before than we had than we had capacity for. But also to keep in mind, as the secretary brought up, and as we look to support our providers to engage with the communities, and the school districts, that almost half that capacity of our overall capacity was actually used to serve elementary school children. And this is important because obviously as schools are making different choices, that capacity is a key critical resource for us that we want to be able to support families in being able to have access that they need. And again, about 55,000 children in subsidy. So you look, it's about 20% of our overall capacity statewide was subsidized. And again, looking at the amount that is actually engaged in elementary school as well there. So if we move to the next slide, I wanted to start to get into some of what does this say in terms of who is returning and who is reopening. So you have here the summary of the reopening data. As I said, almost 75 presented providers with a higher rate of family childcare versus group and school age. The center-based programs. And so when you look at that, we do see that the impact on capacity does mean that we are losing capacity because of the size of our childcare centers versus our family childcare homes as well. And most of our providers do, let's finish this, and Joni, I will absolutely,
I'm sorry.
No, go ahead.
I don't know if I'm on mute or not.
It's hard to see. We'll make it through.
I'm curious as to, in relation to the family childcare providers, do we have any data on those that belong to systems as opposed to independent? And is there anything there to look at?
We are working on that data. Obviously, that is done with our subsidies because the systems are paid through our subsidies. So as I said, with July, just kind of that transition month of everyone get back on, we'll have some of that and can put some of that out. I will say though, with our family childcare systems, there's some engagement that we as a department also need to do to make sure that they know how to support their programs during this time. I think that one of the things that as we look at that, breaking down not only who is in a system and who is not, but what system support is being offered and what the impact is some of the analysis that we plan to do this summer to be able able to help our systems play the best role possible. I think that there is a challenge because our providers are overwhelmed, as we all are, and anxious during this time, and figuring out how you best support someone and being prepared while through that anxiety is certainly new for us all, and wanting to work with our systems to make sure they can do that too.
Thank you. Thank you. I just think that working with the systems is another layer of opportunity. So thank you.
Absolutely. And we are learning from them for sure. So in looking at the providers who plan to open in July versus August and September, we did have the majority of those who applied look to open over the summer. But I do want to say there's still a number of providers, and of the 30 or so % of providers that haven't yet submitted, we have been calling through those and understanding what their plans are and how we can support them, and are hearing a variety of different messages back, both in the question of, I'm not sure if it's going to be this year at all, and also I'm waiting for my school district to kind of understand and see where I can best fit in. And so we do continue to stay in touch with those providers who haven't responded to us yet to try to get a better sense of why and what we might be able to do to support them. And we'll go a little bit deeper into the data of who it is as we move forward. But I do want to say that of those that, aside those, the 163 are people who have told us they are definitively not reopening. They have given up their license. And why we have a really hard time of tracking, like, where you define COVID related in this world where everything is somewhat impacted by COVID. We do know, we broke it down a little bit and have talked somewhat to them, and know that that while these may not be directly a COVID related closure because of COVID exposure or positive, it certainly is a difficult business landscape for them to sustain themselves in, and that is a driving force as we look at this, data. And so we will continue to track this, and we will continue to look at it, but I just wanted to be clear about what we know and don't know at this point. So before we move on to some of the information on what that means in terms of our overall capacity, and what we need, any other questions on this part? And obviously, all of you have different ears to the ground. If you have information that can help paint a more robust picture of what's happening, this is a combination of trying to get some systemic data, as well as placing the appropriate anecdotes in the appropriate bucket to be able to paint a more qualitative picture as well. All right, so moving on to the next slide. So as I mentioned, the capacity data, I don't want to send the message that this is definitive loss, because obviously as we look at group size, as programs are just getting restarted and trying to grapple with their own limitations on group size, I do want to say that this is a snapshot in time and constantly changing, and we are working to try to get a more systemic look of utilization and capacity simultaneously. But when we look at the group size reductions, and remembering that our guidance for this summer did not impact, allowed family childcare to go back to their previously licensed capacity, and for group and school age and center-based programs, the impact was really on just preschool classrooms and school age. We do see that a lot of providers actually opened up with far less capacity, not necessarily due to restrictions in group size, but a lot of due to limitations in workforce or demand. And so we are anticipating, if you look at those providers who open up or who have indicated that they're opening up, and you apply their previously licensed capacity to the fall, we end up with about 3/4 of our capacity previously licensed, as opposed to what is operational right now, which is less than half. With the caveat that this is a little bit messy on how we're measuring capacity during this time. Any questions or thoughts on this?
I had a question, Commissioner, regarding parent demand. Did that have an effect on capacity as well?
So this is an area, Sheila, I will say is a part data, part anecdote. Our data doesn't really tell us that, but our anecdotal has shown in almost, as I said, talking to hundreds of providers over the last couple months as they have reopened, that providers are definitely impacted by parent demand at a case-by-case basis. That providers who said I would be able to open 140 slots only maybe have 50, 60 parents willing to come back in July or August, or needing care in July and August. And so that's where this gets a little bit messy of what are they responding to in terms of limiting capacity as well. And we are looking, Sheila, to get that information. We have launched, you see down here that we've implemented a weekly survey to gather that. We did implement that. We have about over 50% of our providers that have answered that since last week, and we will do that weekly. It has been a great response, and still hope to get over 2/3, over 3/4, over 75% response rate. So we're really getting a fuller picture, but that will help us understand some more trends in utilization as well, as we see what's happening on a week-to-week basis in our providers.
Joan, I think you were going to jump in. Yeah, go right ahead.
So if I'm reading the data here correctly, it looks like the field is on track to lose between 57% and 28% of all capacity. And given how we're defining capacity, that may in fact be a rosier picture than the reality. So yeah, I have two questions. Mm-hmm. I know that you provide data that we're about to see that looks at the regional distribution. But my real question is, which segment of the market, which children and families are most at risk of going unserved? Because we know that because the department, I think, had the foresight to support the subsidized providers, and you mentioned, by the end of the summer, that'll be around $225 million of support into the subsidized system. And we know that a number of providers are coming online, but that may not be sustainable, or they may be increasing their tuitions by 20, 30, 40%, and that there's a limited number of families that can afford to shoulder that increase, or to now shoulder the increase not only for one child, but maybe now also for multiple school-age children whose school schedules are either unknown or uneven. Mm-hmm. So my main concern is about the vast middle ground of families. Is that founded based on the data picture that you have? Who is it that's most at risk of not being able to get their children into safe, secure, high quality care so that they can work?
Yep. Yeah, I think that's a really good question, and something we are trying to get the right slice of data to answer completely. So I can tell you again, this sort of balance of the quantitative data that we've been gathering and the qualitative anecdotes that we use to paint in the picture. And I think you see this in who's already closed down. The providers we hear that are most vulnerable in terms of closing their doors completely are those who haven't had access to public funding and are seeing the volatility in their demand. So again, anecdotally, I don't have data to paint the full picture, but when I do talk to providers, it is the difference between closing the doors completely versus making staffing decisions on a case-by-case basis. And so I think that is a challenge that we have. And one of the things that we don't have a lot of data on right now, but we're hopeful that our weekly survey will start to paint some of this picture, is who are those families that are paying out of pocket to go to care. That I think that we don't have any data on them. We don't track enrollment of private pay families. If they're not subsidized, we don't track any information on them. And so to be able to understand who is relying on childcare during COVID, this weekly survey is asking a few targeted questions around some demographics of families showing up to understand where that capacity is being filled and where are we seeing families finding it inaccessible, and hope that will help paint that picture. I think that we have been working very closely with DCF and DTA and those subsidy eligibility, categorical eligibility areas to make sure that we don't lose capacity for our most vulnerable families. But I think that we all know that at this time of COVID, that vulnerability has taken on a very different definition, and thinking about that and working with our providers to understand who and how they are seeing gaps in access is the lens we're hoping to paint over the next 4 weeks as well. No, it's not as specific an answer as we'd love to give at this point, but I think that's the challenge we have now. And I will be clear from colleagues across the country is trying to track the aggregate, but get enough of a nuance that we're able to catch and be a safety net for those that don't have a lot of other options right now.
I appreciate that. One of the things that I see emerging, particularly as districts are releasing their plans and as employers are expecting folks to come back into settings outside of the home or to, work in different capacities, is that there seems to be an assumption that community agencies and childcare facilities are going to be available. I read a plan last night that said, whether we're virtual or hybrid, we expect community agencies will step in to help families address childcare. And my concern is that that assumption is not tethered to the realities on the ground, and that in the absence of much more concerted coordination, not only at the local level, but also at the state level between K-12 and the early childhood and OST systems, that things for families have a real risk of falling apart. And I'm wondering, I know that the intentions have been good, and I was told in our June meeting that those conversations were happening. But as a parent, and I think also for many programs, that does not match up with the realities of our experience on the ground.
Yeah, I think that this is something that we are keenly trying to gather more aggregated data on as well. The secretary can jump in here if there's more to say on that, but I think from my perspective, this is certainly an issue is on the radar and trying to figure out how we address.
Yeah, just to add on to that, I mean, I think it's a critically important issue, Joan, that you've raised. Not only just to coordinate the logistics of it all, but also the resource allocation in those cases where a school may not be sort of responsible for children in attendance during the school day and are expecting others to fill that gap. And obviously some parents will be able to, but many will not be able to, especially those that are, most vulnerable in our cities, who are essential workers who need to go to work, both for their own, to kind of keep their own family and economics intact, but also to keep our economy intact. So we really do need to, as it's becoming clearer which districts are going to be sort of going down which path, that we are focused on trying to make sure that we're finding resources, flexible resources that may be available to fill some of those gaps.
Secretary, can you confirm what is the date by which the plans are due to DESE? Can you just remind me?
Yeah, they're due August 14th. Okay. So that's
Friday.
Soon. Yes.
Yeah.
So was the real question, who supervises the children during remote learning? And have we policies related to that yet, or is it just so changing that it's difficult?
Yeah, seems like that is in some ways at the heart of this, where childcare and education intersect, right? In service of health and safety for children. It is an interesting and coming to light by the day, right? This notion is remote learning, like who supervises, how do we think about attendance?
Yeah, happy to have the commissioner jump in, but in the spring, since March, when there was sort of this immediate shutdown, not just of schools, but a kind of the entire economy, the home became the place where learning was supervised and children were supervised during the what used to be the regular school day. As we go into this fall, it's obviously a different circumstance. More and more employers are open, more and more people are leaving their homes or have to, more and more people are working from home in a way that doesn't enable them to really supervise their children or their learning. So we're definitely facing a different situation, and it creates some, for lack of a better word, regulatory complexity, because this wasn't really contemplated when either the regs and the sort of the legal regime governing K-12 education or early education were developed. So all I can tell you, and the commissioner can add any color that she wishes here, is this is an active conversation going on a daily basis, and we're hopeful that we'll be able to provide some, at a minimum, some additional directional information or framework so that people have some sense for how this may come out, and ultimately providing as much guidance as we possibly can, including, trying to address some of these resource issues that inevitably will emerge.
Yeah, I think, Secretary, you said it very well. I think that keeping families at the core of that, as this board has prioritized, of saying what do families need and how do we make sure that the regulations can help step up and safely provide that as much as possible is the priority. And I think that as we think about going, I hate to miss, as we deal with the urgency of that this is also an opportunity, Secretary, as you alluded to in your opening remarks, of ensuring that there is a relationship building that might be lasting and sustainable for families as well, while we also try to create this new normal at every individual level.
Now, I wonder, is there an expectation that as towns and cities sort of move through this color system, that the districts will take on more and more responsibility for personal learning? So, or is there a decision that one plan will suffice for the entire semester? How flexible are the districts being?
So there are two answers to that. One is that each district has to present 3 plans, in part because they may need to move from one to the other over the course of the school year as circumstances change. The other, which is not sort of a requirement, if you will, but is playing out in many, if not most places, is districts are providing parents with some options within any general plan that they may have for the district. So, in particular for parents who are uncomfortable sending their children to school, or whose children may have medical issues or other concerns that cause them to not want to place them in school with other children, at least at this time, that they are typically, I don't want to say universally, but are typically being given the option to stay home and to learn remotely. That's easier said than done. We are at a state level trying to create at least some infrastructure to enable that to happen independent of the school district, or supplementing what the school district may provide. But it's a tricky problem. If you're in a class with a cohort of children and the teacher is responsible for all of you, and some of you are at home and some of you are in school, that's tricky. And there are some solutions to it, but they're not obvious and they're not all great. So there definitely is, I would say, policy at a local level that seems to be emerging, but I'm not sure the practice is quite there to match it yet.
Mm-hmm.
I also think, though, that it's important that we not gloss over the state level policy changes that we could be making to facilitate as best a circumstances possible for families that are trying to navigate through just tremendous uncertainty. And one thing that we know that working families need in order to care for our kids is stability. One place where we could potentially act at a policy level that could make a difference would be if we were able to support full day authorizations for children and families that are in the subsidized system, because that would be a way of solving for some of the many unknowns and, frankly, the degree of risk that's being fomented by the way that schools are currently oriented. That if we were able to allow for early childhood and OST programs to create stable cohorts of kids who could be supported in completing their virtual learning experience, have a place to socialize, but also be kept together in order to minimize risk to health and safety, that would be a way of solving some of the challenges that are posed by the broader context. And so I'm wondering if that's something that EEC is looking at, and whether that's something that the state more broadly might look to support as a solution for families and children that are frankly in a fairly untenable position as a result of everything that's transpired.
Yeah, I can answer the EEC part for sure, and we'll let the secretary step in on some of the broader state parts if there's more to say there. So from the EEC part, one of the challenges is the federal regulations that didn't contemplate this either. So we have looked at our subsidies and have been working with the feds and have gotten permission, figured out how to get it in writing that we are able to pay for full day care for subsidized children enrolled in schools. So there is still this question of how, there was this question until yesterday of exactly where the feds were going to fall out on that. And we did work with them and were able to say that yes, subsidies and federal money could be used to help supplement the care and supervision and support for children who might be engaged in virtual learning as their educational attendance, which I think does allow us to support our providers, particularly those that are serving subsidized families, to think about how they partner differently with districts in terms of thinking about the full scope of what families need, that in terms of education and care, really in partnership with each other, allows them to think about how they partner with school districts. That said, I think that we've been brought in for specific community conversations at the community level, and we have been working to expedite licensing processes and expedite adaptations that we can within our regulations to help provide responsiveness in the communities. But ultimately for us, and as I've said to our providers, well, we will do everything within our power to try to bend our process safely and still making sure we are doing honor of what our intention is, but to try to bend the process to provide temporary solutions, year-long solutions for our providers to try to be creative partners. Ultimately, the question of how children travel between a school and a childcare is something, as I mentioned, we don't track enrolled families at a family by family level. So we need people to come together at the ground level who know the family situation, know who needs what care, and start to really create those creative solutions, and have said to communities and to school districts who wanted to partner with us or partner with their agencies on this, if you come up with a citywide solution, with a community-wide solution, and can say, these are the licensing changes, we will work our part to expedite those so that you can implement that. But that is, from the EEC part, our commitment to make sure that our regulations, our oversight of agencies doesn't stand in the way of being able to create those creative, innovative solutions on the ground to mitigate the impact. But it ultimately for us is a provider to school kind of conversation that we can support from the state level. And Secretary, I'm not sure if there's anything else to add from your part on that. But
no, I think you covered it, Joan. It's a great point. We're actively talking about, trying to figure this out. But it's a real issue given the current constraints of the system.
I just have one final clarifying question before we move on, either for the commissioner or the secretary. When a town, city, district comes out with a decision about a fully remote fall, let's say, as we've heard just in the last few days, some more surprising than others. At that moment, is that local government also working? In your experience, are they also then working on child care plans, or they don't see the two as very connected?
I guess my only response is it's too early to tell.
Yeah.
But it's clear that there hasn't, in most cases, I don't want to say all, but in most cases, there hasn't been a whole lot of advanced planning for that. So as districts have been doing their plans, while I know there's been some communication and some, at a minimum, information sharing back and forth, there hasn't necessarily been joint planning about how are we going to handle, just at a minimum, where children are going to be safely located during the school day if they can't be in school.
Right.
But that work needs to happen, especially as communities are making decisions to be mostly or even partially remote.
Yeah, great. Okay, thanks. So, we'll keep going here, Commissioner, but it seems like that ends up, to the extent that we can be helpful or start to think about how to do this regionally or in a more coordinated way, kind of resuming the guiding principles of health and safety and mission. Please, call on us.
Yeah, no, I think this is a helpful frame and very much, I think, starting where Joan has started there, really thinking about what kind of creative solutions that families need, and as trying to really not let the state barrier stand in the way of that. Can keep going on some of the regional information on this. I want to make sure we get to some of the other strategic plan questions, because I think that some of what you guys are all bringing up and in the urgency of the now also speaks to some of the challenges we know we've long had across the country in terms of trying to bridge the early education and the elementary and secondary education worlds, of really trying to think about this as opportunities to build those partnerships to really facilitate the kind of creative solutions that might not only help us make it through the COVID transition, but also to be able to set up the kind of systems and establish the kind of relationships that could continue to try to create innovative solutions for the long term as well. So moving to the next slide, I just wanted to talk a little bit about how this reopening capacity really looks at for the fall. We obviously, and again, this is looking at that. If you refer back to the previous slide, looking at around that 73%, 72% of capacity. So going to the regional slide, if we look at how that plays out, we do see the expected capacity loss in Western Mass and in Boston being some of the deepest. As well as not far behind is the Northeast and Central Mass. Looking at that we see in the Southeast and Cape that there is not a huge capacity loss. I do want to provide a little bit of flavor to that, though, because there was right before, or the year since I started in the last 12 months, there have been a number of community collaborations that have come together, a number of challenges in the Cape and Islands in particular, where the communities have stepped up and tried to come together to sustain capacity. And so one of the things that you see there is there has been some reduction in capacity in that region already prior to COVID over the last 6 months. And that what we see here is those providers also being able to sustain themselves, given the support that we've that they had and prior of being able to, again, come together, collaborate, and innovatively open as well. I do want to note that the note at the bottom is that when we look at the data on family childcare versus center-based, we are losing across the board capacity across the board. But given the fact that the numbers that a family childcare provider serves versus center-based, that a lot of the reductions in capacity you're seeing are driven by a center-based closures in particular. So moving to the next slide, I wanted to just take it a little bit more granular, and I think this relates to some of the work that we have done over the strategic planning of looking at availability of services versus the overall population. And so you see in here the total child population versus the pre-COVID levels versus what we anticipate opening up in September. And I think this is where we see, Joan, to your earlier point, is really keenly putting some eye on this data to understand who might need help through the year in terms of access to non-custodial care, and then how do we start to think about giving guidance and trying to increase the capacity so that we're able to provide the services that communities need. We know that pre-COVID, we've talked about this, and I just want to keep reiterating, there is no implication from my end here that there is a one-for-one that every child in that region needs childcare. Given the fact that we look at access, and it is very difficult to aggregate who needs childcare based on who has access to a grandparent or an aunt or someone else who might be able to care versus, and so we don't have anywhere around in the country around like a one-for-one here, but just being able to look at a comparison point was the point here. And then you have just looking at, we know that there are some places that are going to have extremely limited capacity, and being able to be proactive, to be able to look with our districts, as the secretary said, to be proactive and understand what can be relied on, and where we will have to make choices as well, and try to fill in some of those gaps through expedited processes so that we're able to meet more of families' needs more quickly. And then really looking at a couple of the counties. And I think that it's hard to talk about the capacity loss in isolation also, because we know that for some place like Hampshire County or Martha's Vineyard is having such a different demographic or population change as well, with colleges and higher ed making different decisions. And obviously, places that may have had a differing population in summer or winter months, everything is kind of up in the air right now. And so just wanting to be clear that that's a lens to look at this through. We're not implying anything. This is so much as trying to offer different data lenses that will help us make the best informed decisions in the fall. So moving on to the next slide, and then I'm happy to pause again. I know you all have the deck and have spent time looking at the data, so I'm sure as interested as it can go as deep as you're interested in. But I wanted to look at quickly, Joan, to your point of how we have been able to, and in compliance with the legislative language that came out with the supplemental budget, have been able to have focused on the reopening of subsidized providers, and wanted to be able to show you what that looked like. So you see over half of those who've submitted plans actually are receiving subsidies, and are subsidized, do serve subsidized families, and that well over 3/4 of those that did receive subsidies do intend to reopen, and so that has been. That has been, I think, the driving force for us to make sure families had access, particularly those working families that we knew the Commonwealth relied on as well. And so have seen that there. I think that this is really, we went over some of the subsidy changes we tried to create to be flexible on this. But I think that what we still hear consistently is concerns about staff and staff concerns about coming back due to health restrictions. We have a couple of providers that have not been able to reopen up, not because they didn't intend to, but because of staff illness. And so very cautious about that, and making sure that we aren't penalizing people who are in really COVID impacted situations here. So I want to assure you that we have made very few, because they are limited, but we have been able to accommodate providers who have had very unique situations in here, and we're concerned about health and safety, and we're able to accommodate that and have been able to prioritize that. But you see that I think that from the data, just to reiterate that the interventions and the support that we have been able to provide subsidized providers did show that is having them open up at rates that are providing families who are receiving subsidies at higher levels than we are seeing overall. And I think that's important because as we look at how we're going to sustain over the course of the year, learning from these early months is going to be a really critical point for us to make sure that we're making the right policy decisions in an ongoing way. And with that, let's stop for a second and see, does any questions on that specifically before I move into the CARES update?
Pam?
Yes.
Mary, thank you for all this information. It's quite overwhelming, frankly. I just want to circle back for a second, a little bit self-centered, but Western Mass, where you mentioned where Western Mass will suffer greatly in terms of capacity, is that just strictly bad luck, or is there something more at play in Western Mass that puts us in that situation?
Yeah, I mean, it's not consistent across every county in Western Mass as you see this. And I think that's one thing to keep. If you go to, actually, if you go to the next slide, if you look at, we don't see consistently that every county is seeing the same loss. So that's why I thought it was really important to also break down the regional versus the more county level data. I think that one of the things we saw in emergency childcare was a reliance on family childcare in the Western region, and I think that has been a lesson here too. Is that many of our family childcare are still deciding whether they want to open up, but I think that a few as families are relying on family childcare, and I think particularly seeing that in Western Mass, it is having an impact on our center-based providers who are struggling to figure out how they're going to make it work for the fall.
Yeah, I'll just make one quick comment. I mean, I know Western Mass is more than just Springfield, but as an example, Springfield Public Schools have announced that they will be remote, at least I think through November or up maybe the middle of November. And when I see this data that says that, we're going to really suffer from, capacity challenges, and now we have minimally 26,000 kids in the Springfield Public School District alone, not all granted who are going to need supervision and to be safe, but it speaks back to that conversation a minute ago about, as far as I know, and I hope I'm wrong, there has been no community-wide planning about those 26,000 children.
Yeah, I mean, I think that this is the question that we are trying to use this data, and this is the challenge of the urgency of this time, Mary, honestly, is that it's coming real time. You see this data is, we've been pulling it and analyzing it real time, but every day is a decision point for our communities. And so really making sure that we are we're trying to provide this, get it out there, and have conversations so that communities can do the planning they need. I think real time has never had such a meaning as it does during the summer as we head towards the fall, and I think it's a really critical point.
Thank you.
And I think an area, Mary, I just want to say that we are digging into more, and I really do hope that this survey, I can't answer your initial question with the totality I would like to, given the data we have. And so we are hoping that this survey, as people fill out, will will allow us to come back and have a little bit more of a nuanced conversation about where and what some of the drivers of this loss really is.
And can I ask a quick question? So given what we know about the capacity losses that we've already had and that are projected to continue through the fall, a real concern that the parents who use subsidies have is around the prioritization of who gets the spots that are existing within the centers or within the family child cares. Especially knowing that a lot of centers are really raising their rates for those who, pay out of pocket. It would seem that the incentive is going to be there for folks to stop taking subsidized families. And I think that's a real fear that's out there. Just knowing that there's going to be such a lack of spots. So can you speak to that at all?
Yeah, I mean, I do think that our summer data shows that hasn't been a problem. Our subsidized families have all been, I have yet, and I shouldn't say this as confidently because I haven't asked this specific question, but I have yet to hear of a challenge specifically where there hasn't been a solution that we've been able to find pretty quickly for a subsidized family. I think we see much more of subsidized families saying, I want to stay enrolled, but I'm not sure I'm ready to attend yet. And that I think are choices that our programs are going to be confronted with the fall. If you have a subsidized family that's not ready to attend versus a family that is ready to attend, how do you prioritize across those? We have been trying to give guidance around our subsidized, to our programs that receive subsidized families, that they should continue to prioritize them. And I think that's why we haven't heard that. And I do think that the data shows on the amount of programs that receive subsidized or that serve subsidized families, that their open rates are pretty good. And so I think that are honestly a little bit, I think, concerned with some of the opposite in some ways, because our subsidies tend to be, particularly right now, a more reliable income source than a family who may not be ready to attend but be enrolling out of private pay. And so, you know, I think this is a balance we're really going to have to watch and are looking at when we get the first month of return subsidized data shortly in the next few days, as the billing goes in for July and we're able to see who's enrolled for the first month. That'll be a part of our data analysis that will be highlighted, so we can continue to have that conversation too.
Great, thank you.
Mm-hmm.
Mary, I keep thinking of your 26,000 children and how many of the parents find employment in the service industries and do not work at home, nor do they have the resources to pull together maybe a caregiver to supervise the remote learning for small groups of neighborhood children, and just what it's going to do to the achievement gap that already exists for those youngsters. You know, it's very troubling.
I agree with you completely, Sheila, and this conversation has just energized my.
Uh-oh.
Sorry, I was on mute. Thank you, Sheila. I couldn't agree more. And it really, just looking at all this data has been really helpful in sort of energizing me to think about pushing to see that at least something like Springfield begins to think about a plan. That isn't just a responsibility of EEC, or as Jim said early in this whole meeting, no, it's really a group effort and we have to really work together.
I think that's right. And part of what's so helpful about framing it around these data are that it really is pointing to how much really requires financing and leadership and coordination that goes beyond the walls of EEC, and how critical it's going to be to have that leadership and the engagement of a lot of different folks on both the private side and the public side, so that we can put in place the foundation that's necessary to help families through this period of time and to help programs through this period of time. It's really going to require more than what this agency alone can do. And the need is vast and it's urgent.
Yeah, I totally agree. And I think, you know, I think the one thing that I would personally say just as board chair is I do feel like the last couple of weeks felt like a different kind of stage of this work, and this sort of September hitting us in the face with perhaps less sort of wherewithal and commitment to more in person than we might have expected, given the rates in the state and given where we had been. But it is clear, it is so very clear that the lens now has to turn to children and families and supervision and safety and mitigating a whole lot of learning loss, which we know, you know, we can put together the case for young children are very unlikely to learn in the ways that perhaps a secondary student could in remote circumstances. But again, the conditions have to be there to you know, the food security, the safety, the psychological conditions, the engagement. We're just going to have to, as a state, think now really hard about eyes on kids and figuring out to all of your good thinking ways to get to group learning in some way, shape, or form, while the rates are the rates that they are, which in fact support bringing together safely, as EEC has been doing right through the crisis, bringing together groups of children to promote their development and to support working families. There's just no question. Commissioner, I know we're running short on time. It's 3, so I just want to make sure I now hand it off to you to figure out. I mean, I know we're going to go back to the strategic plan next month. I know we have to get to BRC, so let me turn it back to you.
Yeah, let me skim through a couple of the other things. I'm really glad that you all found this data helpful, because I think this has been a labor of love of trying to cull through the reopening data and figure out how we can learn and use it to be planful. And for those of you who spent any time with me, I am a huge data geek. So this is certainly a labor of love, but certainly laborious, Joe. Just quickly, the CARES Act, I know you spent some time on this. You have this. I think we are still, for those who are listening, who are waiting for the actual payment, we're still working with ANF and making sure that the money's loaded so we can distribute it, since the supplemental budget was signed, and it should be done this week. So excited about that. You have the criteria right here that we used. As a reminder, the supplemental budget mandated that we do put that towards providers who had served one subsidized child in the last year, or were emergency providers. And so this is where you see the choice. We don't have, as programs are still submitting reopening plans, we will give you a more updated review of the data and the spending as we continue to calculate that over the next couple of weeks. But you see there what you have. It was 2 months of grants, July and August, at a flat rate. I think this also echoes, when we think about moving to the strategic plan, this also echoes a couple of the questions that we've been asking around if you move away from a per child funding model, what does that look like and how would that be sustainable? And so gives us a good glimpse, and I will be quite frankly, a lot of bureaucratic lessons learned that can help inform a larger conversation on program financing that I know the board has teed up as we have been thinking about the strategic plan. So going to the next slide, just really, again, we've spent a lot of time on this information, so I don't want to belabor this, I think, but I do want to capture and let you know that as we've been thinking about this, that we've been reflecting this slide reflects what we've been hearing from the field as well. Some of the specifics on particularly that K-12 coordination and school district coordination lens, really thinking about what we need and what operational supports that EEC needs to provide to make sure our programs are sustainable. And then really thinking about the balance for fall flexibility and guidance. I want to highlight, as we make some of the bigger decisions, what people can expect in the fall guidance, and really thinking about we've been working closely with our epidemiology teams at DPH, and as the secretary has referenced continuously with EOE and our partners at DESE, but really thinking about for fall of aligning with DESE's approach, which I think provides a lot more flexibility for our providers to not restrict group size and ratios to beyond what licensing requires, but instead to hone in on those operational things, making sure that the distancing, there's enough space to distance, there is enough space to make sure that health checks happen, no commingling of groups, things that operationally we know will prevent the transmission of the virus without creating artificial distinctions if people have enough space to be able to implement them. So I say that because I know that this has been an anxiety as people think about enrolling families in the fall and preparing for the fall. And as we make some of the decisions that will help color that in the guidance, I wanted to assure people, our providers and all of you, that was something that we were taking very seriously, and that for the fall, we're looking to eliminate any of those structural prohibitions in exchange for making sure the operations are in place and planned for to keep our environment safe. And really to think about that allowing for the flexibility over the course of the year to make sure that providers were not at a place where they couldn't pivot as their community data might look different or change along the way. We also know, I will say, as we move on, we can go to the next slide, but I want to say one other thing on the question of, as we look towards that, we know our providers are thinking creatively, and many of them are limiting their own capacity because they know they need that to do operations. So we want to provide that sort of local level expertise and decision-making and the flexibility to do so. Okay, so as Noni said, Chair Lusso said that to be able to focus on really quickly the strategic plan and a new landscape that we're looking at, and mostly just to show you all, you've spent time with this, you've spent time with It will be online, and we will spend time in September looking at this. But just to reference that we are looking at the landscape that has changed around the strategic plan. It is one of my favorite quips to say that you all passed the strategic plan the day that we went into a state of emergency. And so to make sure that we are not losing sight of the vision that we so carefully set together, but also making sure that in that this was not that we hadn't been tone deaf to the real changes that are happening in our community. And so here you have here a recognition as we look at redrafting some of elements of the strategic plan. There'll be a recognition of the new landscape that we're functioning in, what has changed around us, and what we anticipate re-entering as we think about as we continue to reopen. Moving to the next slide, I just wanted to highlight, and you will all see this shortly, and I'll stop in a second and ask any questions. But we will be recirculating a draft that will have some additional priority some changes in how we've looked at the priorities. Having spent time with the strategic plan over the last few weeks through reopening, I still very much fundamentally believe that the vision we've come up with is the right vision, and the foundation and building blocks are there. But we also know that the order and the urgency of some of these things needs to shift. And our strategies and our action steps are changing because of things that have happened around us. So I don't want to spend so much time on this today. You'll see this in more depth, and we will spend September's meeting digging into how we are building the roadmap that builds us to a bigger future before this. But I just wanted to acknowledge that there are some new ways to think about this, but our construct has stayed the same. Yeah, Joan, did you have
Hi, I just want to make sure that when we talk about vulnerable families, that we're talking not only about employment, but the effects of the social emotional piece that this has on our families and our kids, as well as the educators, because this is the families are dealing with this in many, many ways.
Yeah,
I'm sure I think embedded, but I have to.
No, I appreciate that. And I think that was the beauty of where we came out with our strategic plan, is it was really about also thinking around the community supports that are needed for families, not just about childcare, but about the full suite of supports that children need to be able to be on the path to success from the beginning.
Thank you.
Mm-hmm. Good job.
I want to echo the importance of including a focus on comprehensive services for children and families. We know that the pandemic is having effects that are fundamentally destabilizing to healthy child development and family stability. And we know that we're going to also have a much more challenged social services and nonprofit sector. And so as we look at categories for sustained focus, I think it's going to be really important that we leverage the best knowledge we have about building capacity and high quality practice around corralling the right services for the right children and families at the right time. The other piece that I think may be implicit, but may be worth elevating in the context of areas for immediate urgency, has to do with the financing structure. I know, Commissioner, you pointed to the ways in which the CARES Act funding begins to pivot us toward a more sustainable and stable form of financing for programs. But it seems, given everything that we've seen to date and given what we hear from the field, that pivoting as quickly as possible to a more robust and sustainable financing mechanism that's perhaps more akin to K-12, where you have a foundational budget on top of which tuition and subsidies then lie, is going to be key to creating stability in the field, to building capacity for serving children and families, and also to creating a system that's stable enough and consistent enough that a lot of folks who are on the sidelines in the early childhood workforce right now might consider coming back into the classroom, either because they have stable care for their own children or because they feel more assured about the safety of the circumstances in their program. So that feels like a place that we're going to have to make as urgent as possible, obviously in concert with the legislature and the administration, and ideally the federal government as well. But that's going to be critical to making any of this work.
Absolutely. No, I appreciate that. I think that is absolutely. I think we have recently been working with some philanthropic partners who have helped supported literally, I'm afraid to commit to it because we literally are just launching it, but some thinking specifically on modeling around financing structures and what looks like. And I will be clear, like this is not a Massachusetts specific question, right? Our subsidized childcare program is a national construct that the entire country is dealing with right now as sustaining a critical infrastructure. And so, really hopeful that our work can not only leverage some of the great learnings that other states are also doing, but also really be a model and an innovative example for the country of what you can do when you're thinking creatively about it. So I appreciate all that. I want to just say that obviously we move to the next steps. I'm going to move us to the BRC because I know we do want to get a chance to talk about that too. But one step to go really quickly back to the other slide. So just so you know, we'll be integrating some of this. You all will see a draft. We do hope that pending your review and your collaboration, that we will be in a good place to release that draft publicly, along with reviewing a roadmap with you all in September. Obviously, we know in this time, every plan has to have a significant amount of flexibility built in. So we are not committing ourselves to something that we could be slammed with some totally different unknown tomorrow. And so we'll be very cognizant of that, but also want to give us some direction. So not only do we, but our staff and that is working to support the field understands and has that map to work from as we negotiate what is inevitably going to be a year of a lot of complications. And so I want to make sure from my perspective, specifically in this role as commissioner, that we are dealing with this in a way that takes us forward and builds all of the robust supports that all of you have called out that we know children and families need, and that our workforce is well primed across the board, whether that be childcare or the robust social sector, to be able to make sure that we're playing that role. And with that, we will move on to the background.
Quickly.
Sorry, yeah, of course, Alison.
No, I just, many of us have probably sat in our district school board open meetings. I've sat in on Mass Medical, another medical network. And I just want to comment that there really is a similarity across all of these fields. Everyone is having the same conversations. Everyone prioritize life and death, right? And food on your table and a roof over your head. And now everyone's also getting to the nitty gritty. So our school board meeting last night is like, whatever happened to the after school program thing, right? Everyone's having the same thing. So I want to say that I recognize that this is an unprecedented time. There is no one I would have more faith in leading this than Sam and Noni. You are the smartest people I know. And I don't think anyone's doing a better job. Than this state and these districts. It's just really hard. So I love having all these ideas. I do just want to be clear that we're all trying to do this together, but in the spirit that, this was dropped on us, and we're all doing the best we can.
Kudos, Sam. Kudos to Sam.
It's definitely a group effort. But I do think that, Allison, it is helpful also to really remember that we're all learning together here, and childcare is not the only industry dealing with a very complicated, challenging environment, and particularly that families and children are reliant on all of these systems that are learning simultaneously. And so as systems leaders, the more we can try to share learnings. And I always say to everyone, like, steal our stuff. Like, we've learned something you can use, and vice versa. So that we can try to do this together, because they're all relying on us. So thank you for that. And thank you for the kind words. It feels we're gonna figure out how to do it well. So looking at the background record check stuff, because I do want to make sure we get in a vote to that, because as Noni said, that there is a question of how we think about this in relation to what our workforce needs in the year ahead. So I'm going to give a quick overview, just background, and then I'm going to hand it to Tom to actually walk through for you the specifics of what is in what we're putting out for public comment, and the timeframe for that. So as you all know, at the quick update on, or the quick recap of what long preceded me, is there were changes in the federal background record check regulations that got put, that govern the Child Care and Development Block Grant. And in those, there were 3 driving changes that happened that impacted EEC particularly. One is the fact that we needed to we needed to do the background record checks ourselves and determine suitability ourselves, which is a big operational change versus what we had been doing, which is providing providers the ability to do some of that. Second was there were mandatory disqualifications that required us, these are not all the changes, but 3 of the major driving ones. There were mandatory disqualifications that required us to look at background record checks and set some baseline that was beyond where we had been for this. And thirdly, that it required us to change the order in which we were doing our authorization. So people actually had to have fingerprint results before they could be determined to be suitable in the classroom. Or conditionally suitable in the classroom. So we have been, that's it. All of what I just described are big operational changes that take time and changes to make in terms of that. So as we did that simultaneously with the regulatory changes that were put in place, I came on obviously last summer and started to dig into what we had learned in the first year of implementation, and did receive some litigation around one particular regulation that we had put in around using juvenile delinquencies equivalent to an adult conviction. And so we did stop implementing that, if you remember, in September, and have looked at juvenile delinquencies not equivalent to an adult conviction. But since then, there's been a couple other learnings and a couple other changes that we wanted to address in here. I wanted to highlight, as we look through these changes, that a driving force for us is really looking at equity and how we make sure that our system is as equitable as possible and allowing for the nuance while still setting health and safety standards for children. And so we know that backgrounds and background record checks are nuanced, and people have a myriad of different circumstances when you read a piece of paper that show a criminal history. And so one of the key things that we're still working out operationally is a process by which someone who we deemed not suitable would be able to come and help us understand and provide more color for a reconsideration. So while it's not all worked out yet, the regulatory guidance that Tom will go over that we're asking for public comment really do set the foundation for us to allow to talk around policies and operational procedures that will accompany and stem from final regulation. So in knowing that this is a critical need for our workforce, and knowing that a workforce that is going to be in jeopardy as we move forward and try to sustain and build more capacity, we want to make sure that we are underway in making these initial foundational changes in a way that will allow us to continue to support the field. And with that, I'm going to turn it over to Tom. Oh, sorry, I think I skipped a slide. So if you go to the next slide, that was actually what I was supposed to be talking about. And the following slide, which gives you a little bit of the background, and then he'll go over the specific changes.
All right, thank you, Commissioner.
So turn on your microphone.
Yeah, so I can walk you through some of the major changes here. So there's a couple of pieces to be cognizant of when we're going through these changes. So obviously the Commissioner mentioned that we're going to maintain compliance with the Child Care Development Block Grant. So that's our main goal. We also have some of the litigation that she mentioned last year that initiated last August. So we're going to make some changes to kind of codify some changes that we made last September. And then the other big piece is the Families First Prevention Services Act. So what you need to know about this is essentially it's another federal law that applies to some of our programs. It applies to some of our residential and placement programs. And it's actually a subset of those programs. So it's certain programs that receive some sort of federal funding under the Title 4E of the Social Security Act. So it's kind of a subset of those programs. So that's kind of the major driver of some of these changes. So I'll walk through this first slide here to give you kind of an overview of some of the major pieces we're changing. The first is under the definitions section. So we're changing or adding a definition of youthful offender. the purpose of this is really to distinguish between the two categories of offenses that juveniles can face. So there's two separate proceedings. There's one as a youthful offender, which is an indictment. The other is the adjudication as a delinquent, which the commissioner alluded to just a minute ago. So one of those can actually result, the youthful offender indictment can actually result in a conviction, and that juvenile could face an adult sentence. So those are going to remain the same, and we wanted to add that definition in here to kind of distinguish that. The other piece is the juvenile delinquency adjudication. So these particular adjudications are not considered convictions. They're held in the juvenile justice court, and they're meant to be kind of focus on rehabilitation versus punitive. So we wanted to add this definition to kind of clarify, which will lead us to the next point under section 14.10 on the mandatory disqualification piece. So as many of you will recall, mandatory disqualifications arise when a individual has a conviction for a certain crime outlined by the federal law, and this results in a blanket, automatic disqualifier where they have no appeal rights. And so previously, under regulations, we had considered the juvenile delinquent adjudication as part of that category. So since last summer, with initiation of some of the litigation that brought this to light, we did stop implementing that as a practice since last September. However, this change here is actually just going to codify that in regulations. So essentially, we're going to remove the language that suggests or states that juvenile delinquency is a conviction and that it's subject to the mandatory disqualification. And we're going to remove that language, but we are going to clarify that any youthful offender conviction, that still remains. That's still a conviction. That's still subject to the mandatory disqualification, but we are making that change to eliminate the juvenile delinquency finding there. So that brings me to the next piece on the presumptive disqualification. So essentially what we're doing is we're moving that juvenile adjudication from the mandatory disqualification, and we're moving it under to a presumptive level of review. So presumptive level of review isn't an automatic disqualifier. They do get a review period. There's a little bit of a higher level of scrutiny that goes into that, but essentially we're modifying that 14.10 subsection 5 language to put those crimes under that. So it does allow for review. It's not an automatic disqualifier. So that's the major pieces around the juvenile piece. The last point on this page is related to a hearing process. So some of you may recall from listening to the prior BRC regulations and the process is that we do have an appeal process for certain individuals. So for example, an individual that's applying for a license, whether it's a family child care or group of school age license, if they are denied through our discretionary review process, they do get an appeal right. It's an administrative appeal right that goes through the Division of Administrative Law Appeals. However, if there's an individual that's applying to be an employee of a program, so they want to apply for a group and school age program, they get denied, there was no appeal right for those individuals. Essentially, once they went through the review, got a denial, that was it. We wanted to change that to allow for some sort of appeal right for these individuals. So we did change the language in this particular provision that's going to allow for some sort of informal hearing process. And as we, once we codify this, we're going to start working through what that appeal process will look like. And we can put, a policy and operational procedure together of what that will look like. But it'll be an informal process that will at least allow for the individual that does get denied to have a second layer to go through to get some other eyes on it to see whether that was the proper decision. So we are proposing to implement that. So next slide, please. So this slide here is going to relate to changes that actually relate to the Family First Prevention Services Act. So again, this relates to kind of a subset of our residential and placement programs that receive certain federal funding. So the first piece under here is a pretty minor piece. It's just under the policy section. So the policy section of our regulations just outlines what the statutory framework is, so what the governing authority is. So what we did is we just added the citation to Families First, just so that everyone's aware that this is a governing authority for these regulations. There was also a definition within that policy section of what a background record check actually consists of, which somewhat conflicted with the actual definition a couple sections below that. So we just removed that language just so to avoid any confusion on that. So that's just a minor removal on that. The next piece under 1405 is related to some mandatory disqualifications and out-of-state checks as it applies to residential and placement programs. So as you may recall from prior presentations on the BRC regulations, certain provisions of CCDBG would not apply to the residential and placement program. So these out-of-state checks, these mandatory disqualifying crimes, we had language in our prior regulations that these did not apply to these programs. However, under the Family First Prevention Services Act, there are certain out-of-state checks and certain mandatory disqualifying crimes that apply to this subset of programs. So these programs that receive the federal funding. So we made a pretty discrete change here that says that these checks do not apply, these disqualifications do not apply unless required by state or federal law. So it gives us the flexibility to implement certain checks and certain disqualifying crimes for that subset of programs that do get that federal funding. So pretty similarly in the section below that in 14.10, there's language that normally under our existing regulations, anything that was deemed a mandatory disqualifying crime for typical child care programs, we would consider that a presumptive review for residential and placement programs. But in this circumstance, given the Families First law, there are certain requirements that have to be mandatory. So we made the same change here, essentially stating that unless required by state or federal law. So for the majority of our residential placement programs, if there's an equivalent of a mandatory disqualifying crime, it would be treated as a presumptive. However, for this certain subset of programs that get that federal funding, there could be it may not be considered a presumptive, it may actually be a mandatory. So it's just some language that we added in there just to provide flexibility to implement this Family First Prevention Services Act. And I will note that we've worked pretty closely with the Department of Children and Families in trying to implement these requirements to make sure that the law is under their jurisdiction, but we have been working with them to make sure that we understand it properly and we can get the language in there that we need. So you can go to the next slide. So this is just a timeline for what the next steps will be. So if we have a successful vote here today to put the regulations up for public comment, essentially that will become effective immediately, and we'll post to our website the red line version of the regulations as well as a clean copy. We'll open up the public comment period. We'll begin soliciting public comment, written public comment, electronic. And ultimately what we'll do is we'll go forward with a public hearing. So normally we'd have an in-person public hearing where they'd come to central office, where we'd host it in certain locations around the Commonwealth. Given the current climate, we'll probably do some sort of virtual or Zoom public hearing, but we're looking to do that sometime in September, hold multiple public hearings throughout via a virtual platform. So sometime in September we'll have three dates that we'll do that. Once we complete the public hearing process, we'll close out the public comment period. There is an internal review here at EEC where we'll go through all the public comment, we'll review them, we'll make changes as necessary. And then ultimately we'll be back here before the board, and sometime in October, ideally we'll be coming back, presenting what the public comment was, what our responses to that were, and then essentially presenting the final version of the regulations for promulgation. If we do have a successful vote at that time, we would then file them with the Secretary of State and the Mass Register, and they would become effective 2 weeks later. So that's the ultimate timeline. So that's it for me. Any questions or anything I can address on the changes?
Folks want to jump in with any questions or comments? I feel like it sort of has been this ongoing conversation for a while. Clear to me that it's been thorough and probably time to move forward, but that doesn't mean we can't discuss or entertain questions, for sure. Just want to thank you for this kind of prolonged, I know, amount of work on this topic and issue.
I just want to
I'll mute.
I just wanted to say one more thing about the residential and placement programs. I appreciate Tom bringing that up, and particularly with the Families First Act. One of the things that I think we will be looking at is how to, there is an approach that has applied all regulations to all programs, whether they apply to them or not. And we are looking to try to figure out operationally how we can make sure that residential and placement programs that obviously have very different needs than our child care providers that we're running background record checks for would be able we'd be able to honor those needs accordingly. So that is an operational question for us as well, but the regulations allow us to do that.
Carolyn, did you have anything you wanted to add? I know in the past you've been really helpful on this topic, but I just want to make sure, but I know we're running shy on time, but I just want to invite you in case you had any thoughts.
No, thank you, Noni. I just want to, I would just want to express my gratitude to Sam and our team for addressing this, you know, considering everything else that they're dealing with right now, to really be able to focus and get this done is very much appreciated.
Yeah, I agree. Thank you. Okay, I have a good old long motion. Are we ready? I move that the board, in accordance with Massachusetts General Law, Chapter 15D, Section 3, hereby approves the amended regulations governing criminal offender and other background record checks, and authorizes the Commissioner of Early Education and Care to file the amended regulations with the Secretary of the Commonwealth for publication in the Massachusetts Register for public comment as 606 Code of Massachusetts Regulation 14, consistent with the department's proposed policy directions and subject to the approval of the draft regulations by the board. Can I get a second?
Second.
Thank you, Carolyn. And then I will do a roll call, and I assume we'll go with in favor, opposed, or abstained. So let me just get this view ready. Let's start with Sheila Balboni. Yes. Sheila Balboni.
Yes, I approve.
Joan Wasser-Gish.
In favor.
Eleonora Villegas Reimers.
In favor.
Joni Block.
Favor.
Dave Cruz.
In favor.
Mary Walke.
In favor.
Carolyn Kane.
In favor.
Nikki Ruiz de Luzriaga.
In favor.
And am I right to call on you Jim Pizer?
Yes, you are.
Okay,
You
go right ahead.
Yes.
Thank you. All right, I think that concludes the vote. All in favor, and we will circle back post public comment on this to close the loop. Tom and Sam.
Yep, absolutely.
Yep. Okay.
I was going to say we had an EEC next steps, but I think we have discussed everything on the next steps since then, so we won't belabor the point, and thank you all.
Great. So I will end where I began, which is to say it's very clear in these 120 minutes have just underscored the complexity of the landscape and the extent to which I think we all look even further at the landscape of the Commonwealth for children and working families in particular in the coming months, but even all families. To Joni Block's point, this is certainly a very, very, very challenging time, and it's really, really hard on the family unit, on children, and on youth development. Clear from the emerging data that mental health issues are certainly on the rise. You cannot have these unemployment rates without greater attention to thinking about childhood comprehensive services and supports and a safe and healthy place for them to be each and every day. So I think we just end by underscoring the commitment that we have as a board, the gratitude to the field of early education and care, and also suggest to the commissioner and the secretary, to the extent that we may need to regroup and think creatively about the childcare landscape. We have a standing meeting in September. We may also need to talk again about that very issue in more depth and think really creatively about the coming weeks and months, which feel both imminent and urgent and uncertain. So just want to thank you all for your time. Thank the secretary, the commissioner and her team for their tremendous leadership, and once again, the field for just so reliably and quietly in the best possible way, holding up a lot of great work on behalf of the Commonwealth. So thank you. And thanks to everybody who came this afternoon to this meeting. Take care.